His profession was taking care of others, 15 hours a day to the point of exhaustion. Last January, in his office, it all fell apart.
It started with anxiety attacks, then full-blown panic attacks without warning. And that, doctors can't allow ourselves to panic. We just can't. When I saw that I had crossed that line, I made the decision right there, in the midst of a consultation, to stop.
Now hospitalized for the past 4 months, this independent general practitioner had initially tried to treat himself.
Obviously, when it gets to a certain point, you have to seek treatment from a psychologist or psychiatrist. And that's crucial, but it's also traumatic. There's a feeling of dishonor, of guilt. Going from being a doctor to being a patient is very difficult.
Still in treatment, he plans to return to work in the fall, but part-time as an employee. Many like him are seeking strength to break their silence before it's too late.
Hello, this is Emmanuel. I'm a psychologist. How can I help you?
This is my first time calling. I'm a nurse. This morning I completely fell apart. We're under so much pressure all the time.
This emergency line is for health professionals. It gets 5 or 6 calls a day, all guaranteed anonymity.
Early this morning I was attending to someone and I didn't pay attention. I didn't read his chart and I gave him a betadine swab without noticing he was allergic to it. I didn't kill him. But I feel like I'm carrying everything that the hospital has been dumping on us for months and months now.
Psychologists are on hand 24 hours a day to help their troubled colleagues. Emmanuel Gontier is one of them.
And your management, have you already let them know?
We went to see them. We told them we can't keep this up. There's 6 of us covering 12 positions. 2 haven't been filled, 4 are on sick leave. We're working double. I feel like there's no way out. I have to find one though, because I feel like I'm dying here.
I think it could help you to talk with someone who has a specific approach for caregivers.
Thank you very much.
You're welcome. Goodbye.
Goodbye.
Gontier is a therapist specializing in occupational hazards. She says that those trained to help others have an especially hard time accepting their own needs.
We tend to forget ourselves in terms of health, of self-care. We often believe that by saving the world, we're going to save ourselves. But unfortunately, it doesn't work like that.
Whether it's from overwork, administrative pressure, or interpersonal conflicts, according to polls, nearly half of all caregivers are affected by burnout and depression during their careers. It's an affliction that doesn't spare medical students. They're 3 times more likely to suffer anxiety and depression than the rest of the population. The government says it's taking those figures very seriously, though the subject is absent from healthcare system reforms adopted in July. France's health minister has inaugurated a new center for interns, doctors, patients, and professors. Its mission to detect warning signs, ensure sufficient downtime, and better train future healthcare workers. As for caregivers in distress, the minister is relying on the Observatory for the Quality of Professional Life, created 1 year ago.
Based on the observatory's findings, we'll see if we need to adapt our support for caregivers in their daily work. It's part of what we're currently watching in our healthcare facilities, particularly in hospitals, to evaluate their capacity to support their medical staff.
In the meantime, health professionals are relying on other options. Roughly a dozen establishments now specialize in the treatment of doctors and medical personnel. In the foothills of the Alps, this psychiatric clinic opened a dedicated unit 1 year ago. 20 of its 80 beds are reserved for caregivers. Claire Sellier leads the unit.
Et vous avez fait son pansement. Ok.
The psychiatrist herself has struggled with the same problems and the reluctance to face them.
Myself being a healthcare worker and having received treatment, I understand the gravity and how hard it can be. It's extremely difficult to stop being a caregiver when you do it all the time. It's hard to let go. Our job here is to help the caregivers be patients.
Among themselves, far from their workplace, doctors, nurses, and other health workers can more easily engage. All present similar pathologies.
Exhaustion at work, burnout, anxiety, depression, and post-traumatic stress.
This nurse has been hospitalized for a month after gradually sliding into depression.
My patients could see that I wasn't well. Some even confronted me about it. I was no longer a caregiver. I was aggressive, even with my colleagues. I had become harsh.
When will you go back to work?
For now, I really don't want to go back to where I was. Even though I love my work, I love psychiatry. It's perfect for me. But to work in those conditions, I think it's dangerous. There's violence, patients aren't medically taken care of. They're always asking for more and more, but with fewer and fewer resources. We have less and less contact with people. Instead, it's all on the computer. It's like working in a factory.
Though the question of resources and working conditions is far from resolved, the plight of healthcare workers is now at least getting more attention and more care.